Okay, that's enough of that. Today, we're recycling one of our former speakers just a couple of weeks ago. But that's just because he's so involved in his community and cares and loves the Kingsport, not only the Kingsport area, but the whole Kingsport, Southwest Virginia area. We thought it appropriate that the program committee to bring a special service organization like this into the program today to tell the story, because there's a significant need for funding all the time. If anybody, and I'll just make the plug, if anybody has year-end gift planning, right here, you couldn't find a more deserving group that's going to present today. Dr. Harry Turner is going to introduce the program. He's got some very special people with him. So Harry Turner, longtime friend, and
sit down. You've had your exercise for the day. That's very, very good. Thanks so much. If you'll come back in 5 weeks, I'm going to be speaking on underwater basket weaving. And so you all are fun to be before, and it's really a pleasure to be there. Thank you. You do so much across this community and obviously beyond state lines. It's so good, and I respect to you. Steve Kilgore is going to be presenting all the important stuff. I'm just going to be the part of the color of this sort of stuff. But Steve, you all know Steve, so I won't belabor it, but Senior Vice President, Ballot Health, Retail, Outpatient Services, Business Development. He's been involved in community and related healthcare issues for the last 30 to 35 years. And if you have a go-to person that you really need to help with problem solving, Steve is absolutely your guy to help with that. And so thank you so much for being on the board. He is an active, involved person, and I lean on him very, very heavily. Anita Hensley, who is the Assistant Executive Director at Friends in Need, is with us today, and she again is the brains of the outfit, as well as the person who gets all the stuff done and coordinates it in a positive way. Claire Kilgore, who puts up with her dad, is very nice to be and works as an employee related to activities and bringing patients in. It's really a very helpful type stuff, and she's really a sort of IT and coordinator and facilitator and communications role. So won't say any more about that. But Friends in Need Healthcare has been in existence since about 1995, and Rosalie Seitz, who was here the last time, I ran her off in my last talk, was part of the brain trust that came up with that. And so Bill Hudson was part of that, Tom Brock was part of that, and others who were really fundamentally involved. And this sort of came out of the observations they had of the emergency room. You'd see people, you'd either address an issue, or you'd stick a Band-Aid on it and need to say, you need follow-up for your hypertension, for your diabetes, for your significant medical problem, etc. And then pat them on the rear and send them out. And of course, there was no place for them to go to. And so legitimate issues existed about access to health care. That problem has not been solved, if you happen to notice, around every community, and certainly that's true in Kingsport. And so their notion around tables and a lot of coffee were, how do we try to address those types of health care inequities that we see across the community? And so their solution to that, their proposed solution to that, was to create a faith-based response that would try to deal with medical and dental needs for the uninsured of this community. And it was a great notion, it was appropriate, and it kind of came out of a heart of service and love to this community. Lots and lots of folks have been involved in that in different ways. Again, for the working uninsured, with the notion that if you could get a way where people could come and get access, they could continue in the job market and continue supporting your family members. That's been the goal all along. That continues what we focus on now. We have expanded over time to be focused kind of not only on the uninsured, but really for the underinsured, because as you know, that has changed remarkably over the last decade. And so you may be insured, but if you've got a $6,000 deductible, you're uninsured. It's just the fact of the stuff that we're dealing with. We do use federal poverty guidelines. We use a sliding scale. About a third of the folks are not able to pay anything. And the others are generally kind of into a $10 to kind of a $30 range on the lower end. And of course, it takes a lot more money than that to see those patients and care for them. lots of support in lots of different ways. Initially a volunteer staff for the most part, with sort of a part-time executive director. And that over time, because of growth of need for those services, has gradually expanded over time. Community volunteers have always been an important part of that in terms of coming in and helping with painting, fixing up, taking old space and making it into new space to be able to kind of meet the needs of what you were proposing to do for that. And so members of this organization, as well as many others, have been very helpful at different times in the past, trying to help with those particular needs. Growth has occurred over time. We've had wonderful volunteers come in with very specialized stuff, people like Frank Waldo, who most of you all know, Charlie Sorrells, who can come in and take unique needs and problem solve and make those things work, for which we are very, very, very grateful. As we've grown, they've moved from offices on Ravine Street, and then for many, many years we're on Stone Drive. And then most recently, like in the last couple of months, have moved to 1916 Brookside Drive, very close to Indian Path. And so you could almost, if you could take down a building, you could look from the ER across to where this office is now, which has given us room to expand and grow and do some things which are really very, very important. In about 2014 or so, as a response to a need perceived by the United Ways, it looked across unmet needs in the community. The dental need was so great. It was already being partially addressed with what we were doing, but trying to expand that significantly. Bruce Seitz kind of took on that at their request, and the result of that was Appalachian Miles per Smiles, which was essentially a mobile dental unit that could go out into the community, as well as affiliate with RAM. So regionally, there's been an impact of that. Yesterday, they were in Mountain City, or supposed to be there today. The dentist who were going to support that came down with COVID, had to cancel that clinic today, drive all those things back over this way. This has also been tied with vision activities that Lions Club has supported. Ballard has frequently tied that up with a mobile mammogram unit. Joe Smitty pulls a big trailer that has radiographic things in it. So I mean, it's really a remarkable adventure that's happened there. That's all spin-off of that, which came out of development from Friends in Need. That group is, appropriately as we planned to begin with, probably going to be able to be separated by about the first of the year. So it just makes it much cleaner bookkeeping whenever you can kind of have two busy organizations keeping their books apart instead of having to funnel from here to go over here. That's been a natural evolution that's been planned for a long time, and I think is about to happen. We've been working on it since 2019. A little complicated. So a response is really to limited care options that we have, medical and dental. Looking at numbers, when we got our statistics, which Anita supplied to me just a few days ago, this is through November, and then we annualize those. For 2022, we will see on the medical side about 1,300 plus patients for 1,760 or so visits. It's a lot of visits. If you add to that all the COVID activities of screening, assessing, going out and doing things, providing vaccinations and whatnot, that's another 1,600. So that's about 3,500 and change patients that are face-to-face encounters that we have. That's this year alone. When we look back at that stuff in 2021, those numbers were about 2,500 plus about 2,900 visits. When you look back into the mouth of COVID, those numbers are like 834. So the need has been there. Our numbers are higher than pre-COVID, but it's significant. When you look at the dental side of stuff, annualized patients seen about 1,700 plus. It's a lot of people. If you will drive by a drive-through fast food place and you give them change and notice the smile, you notice why we have a real dental need in this community. It is rampant and is needed in this region, especially needs it. So that's a little bit about our basic numbers. I wanted Steve to come and share with you all essentially when he looks at things about how this impacts the community, what we do, and how it impacts Ballad.
It's good to be here. Thank you all for the opportunity, and it's good to see some familiar faces in the room. I first became involved at Friends in Need probably about 10 years ago or so, when, of course, I was previously with Mountain States, of course now Ballad, and as you all probably know, both Mountain States and Wellmont were both financially supporting it, at least at some level, the activity at Friends in Need, in addition to other charitable clinics. And of course, I had a pretty persuasive conversation with Bruce, and I think you know what that means. That's when I became a board member. I'm a past president of the board. And I would just say this, Harry has, as you all know, very unassuming and a very modest person. He's done a fantastic job as the president of Friends in Need. And I often tell folks, I think we probably have the best board today that we've ever had. We have a lot of great folks who are very engaged and passionate about what we do. So I want to be brief to recognize the time, and and provide some time for questions as well. And thankfully, Anita is here to answer some of those for us. But I do often get the question, why is this so important, for Ballad, outside of just the obvious reasons? And there's two or three things I wanted to just focus on. One is probably obvious, and that is the fact that this provides immediate access for patients that otherwise are going to crowd our EDs. And this is a significant issue for us. It's never more true than what we find today with the increasing pressure that we have in all of our emergency departments really across the region. All that's been exacerbated by the labor issues and so forth. And the truth of the matter is, over the years, many of these patients have come to rely on the emergency department as actually their source of primary care. And the reality is, though, that is probably not the right place. It's certainly the more costly option. And so for clinics like Friends in Need, this is strategically something very important for Ballad to try to support organizations like this and drive patients that are more appropriately cared for in settings that can be a little bit less costly and certainly more appropriate, freeing up the emergency departments for patients who truly need to be there. There's a couple of things that I think are worth mentioning that you may not know about. Most of you have heard about Friends in Need, and you know a little bit about, or maybe a lot about, the history. But there's a couple of things I think are really important, and that is how we work with other organizations across the entire region and what that means for our patients. One of those is Project Access. Project Access is a not-for-profit organization that we at Ballad helped put in place a few years ago. It's essentially a network of over 500 medical providers, facilities, particularly medical specialists, who have agreed to partner with us around the notion of accepting referrals for patients who have no ability to pay. And so we're able to access referrals for patients and get them scheduled to be seen by a specialist, or it could be a diagnostic issue or whatever the case may be, with folks who have agreed to participate in this network for the benefit of this entire region. Ballad actually has I keep calling him a community social worker, but it's essentially a navigator, right? Ballad actually has a team member sitting inside Friends in Need today. And so when a need is identified with a patient visit, for a referral, for example, we can put that patient right in front of our navigator and help secure that appointment and so forth, so that there can be some continuity of care created. That's very important, in terms of providing care for folks who are in need. The other organization that we partner with and work very closely with is related to that. It's Appalachian Highlands Care Network. What this allows us to do is to actually connect patients with organizations and agencies to have their social needs met. And for those of you who have any healthcare experience, or you may have heard this term about social determinants of health and how important that is in terms of closing gaps in care for patients. so that they can return to be fully, certainly more functional in their daily work life and just everyday life. And so we can actually connect these patients with agencies and so forth so that their social needs can be met. That could be food insecurity, it could be transportation, it could be housing, it could be paying their electric bill, whatever the case may be. And so the partnership, I'll call it a partnership, the relationship certainly that we at Ballad have with Friends in Need is very important. And all the things I'm describing in terms of these additional resources that we can bring to bear really are important. This is really important work that we're doing for patients who otherwise likely will not have their health care needs met. And the need is certainly great, and it is growing. There is no question about that. So I'll stop there. I just wanted to spend a couple of minutes to talk about how we work with Project Access, Appalachian Highlands Care Network, and what that really means really for the region and for the patients we serve. I'll turn it back to you.
Thanks, Steve. Anybody been in the emergency room the last year or two? Did you come out with a $125 bill? You can't walk into an ER with bad breath or a sore tooth for less than $1,000 or $2,000, and for understandable reasons. You know, the cost structure you create with that, because you're in the most inefficient place on earth to be able to get care, because it's designed to be an emergency room. It's not designed to be a primary care office or a substitute. And so that's why the real benefit that you have to a place like Ballad, whenever you can keep people's care in a lower cost environment, keep people out of the hospital, keep them working and functioning. So the last year has been a challenge. I've been, I guess, president of the board for a couple of years now, and so I had black hair 2 years ago. It's been a perfect financial storm. And those of you who have been in business, those of you who've related to nonprofits, those of you who've tried to maintain a business during changing environment, know exactly what you're talking about when you have storms that arise that are not really predicted. So in the 1990s, this early model, if you would, that we had was really dependent predominantly on volunteer physicians and later volunteer dentists. And volunteer is pretty cheap. You know, you can do pretty well controlling your personnel costs if everybody's there and happy to be there and they're pleasant and they periodically show up and you address the problem and you sort of grow to the need that you have. So you went from that sort of volunteer base, which is probably to the, 2005 range, something like that, to an environment where you sort of had some nurse practitioner provision of care with a generally a volunteer physician supervisor to later a part-time physician supervisor who was not paid much but was paid something, and the nurse practitioner was very generous and underpaid but still paid something. And then you had dentists who really at that time were very, very generous in the provision of volunteer care, and for whatever reason that changed to where when most dentists now retire, they surrender their license. And it's not being mean and honoring. They've been standing bent over at a crooked angle for years and years, and their neck kills them, and their shoulders are killing them, and their hips are shot, and their knees are gone. And I understand that. But I also understand that you lose great experience and efficiencies and knowledge when those folks drop out of the dental care market. But so you then had to hire dentists. And dentists and physicians and car mechanics, none of those people are cheap. And so you went from a volunteer low cost structure to a cost structure that gradually builds. And so that changed. In about the 2005 to 2010 range, there were a number of very good and generous corporate givers for really operational funds like the Blues and Aetna and United, the various kind of 5 or 6 major kind of healthcare players would typically invest around $50,000. Not all at the same time. It seemed to be sort of a rotational thing. I think they'd probably get together at meetings and pass that around. But they would then, you could sort of depend on those folks to have a $50,000 gift for 3 years in a row to you. So you really had some undergirding support for operational type stuff. Then along came COVID. The good part of COVID is that we had provision through PPP that kept your organization together and provided salary support for people who could not come in. And so even though your patient visits and all these other things really plummeted for appropriate public health reasons, you could keep your organization afloat. And then in the last year or two, what has happened is that those corporations which provided baseline support tried to respond to COVID needs. And so you go with the United folks who were very, very generous in the past, and you go to their application site for grants. And their grants are now focused, for example, on providing school lunches support. Or you deal with other organizations like Cigna who migrated toward providing psychological support, addressing isolation problems and depression problems and those spin-off problems that we're all acquainted with COVID. But they're not supporting the things they did before. They have finite resources. I recognize that. What they're doing is entirely good. But those bedrock support folks that you had before have now refocused. Now, Friends in Need and all the other similar medical and dental nonprofits across Tennessee get in the same situation, and that they really have lost that undergirding support that they have. And then sometime in about April or so, Safety Net, which provides some provision of support for medical and dental type things, decided that they could pay less for what they were paying. And so you went from $55 to $60 an encounter for a medical visit or for a dental visit, and decided really that should be cut down to about $45 to $46 a visit. Now, our expenses did not go down. In fact, might have gone the other way if you all haven't noticed. But what happened is that it caused a huge outcry across the medical and dental charitable organizations in the state to their local representatives and everything else. And people were just burned by that. And so, remarkably, there was a political response to that, said, we shouldn't have done that. That was not a good idea. And in fact, we're going to increase that significantly to like $100 a visit, which is not bad for medical and dental. And so everybody cheered for that. Now, that didn't help you with your previous quarter's income that you were going to have. That was to reimburse you partially. But then, when that was introduced and the cheers died down, the medical side of folks forgot to make their $100 change. The dental folks were going to, and so we said, we will correct that next quarter. Okay? So you've been drilled again. And so all that is good, and so that was supposed to take place and those things be hunky-dory by about the 1st of September. We'd still be hurting if we had all that stuff. We've not received any safety net money since August, early August, because they're changing over their system for how they do that stuff, and it's very complicated to write out a check apparently. So you've bled people down every place that you can, and then don't pay what you had. And so you're sitting here with $110,000 floating around out there that's supposedly coming to you at some point. Haven't seen it. And Anita's nice, and you can call and kind of ask people nicely a time or two or three, even when you're bleeding. But after a while, you're perceived to be not the squeaky wheel that gets the grease, but the squeaky wheel that gets put to the bottom of the pile. So you've gone from a neutral cash flow status a year ago to significantly being in debt over the course of 1 year from all those things. So that's now not how any nonprofit wants to work. So when you have all those things happen, you've got to look and you've got to figure out you need to have a change of model. So Steve's going to touch on that just for a minute.
make this quick. We're pushing on time. So, well, about a year or so ago, I guess Harry and our board took on the task to do have a planning session to really look at a number of things that we were doing. What could we do better? The building and the facility was one of the things that we wanted to address, which we've been successful in doing. The other was, what are some of the other ideas that we may have to expand our business model? Harry sort of made the case and laid out sort of what's going on from a dental perspective and from a financial perspective. You know, heretofore, Friends in Need has not participated in TennCare at all. We've talked about it, chosen not to do so. But given the circumstances and the landscape, and in particular from a dental perspective, we all know the direct association with poor oral health and major chronic disease. We know what's going on at the state level. You know, our governor a year ago convened a work group that was comprised of dental providers, agencies, payers, Tennessee Department of Health, et cetera. They came up with this Healthy Smiles initiative. Some of you may know a little about a 5-year plan to invest in oral health across the state. It's like $94 million. $12 million, I think, was allocated in the first year of that budget. And of course, our state is particularly challenged, right? We've got, I think the last number I saw was 46 dental providers per 100,000 in terms of our population. Nationwide, that number is greater than 60. That ranks Tennessee about 45th in the nation. Not a good place to be. So we've been having this conversation about what would it look like if we were to expand our model, take on TennCare, particularly from a dental perspective. It opens up the ability for us to take on children down to age 7, I think it is, which of course we don't do today. And it opens up a potential revenue source that we have not had in the past. It's no secret, Harry mentioned it, we're like most not-for-profits. We live on the margins. The margins are very thin, and all it takes is a delay, in this case, with the Tennessee safety net payments or whatever else, to really put a lot of pressure on our ability to continue to do what we do. So we are in the stage right now of completing some due diligence around participation with TennCare from a dental perspective. It's interesting, dental is totally separate from medical when it comes to TennCare. So there's actually a dental benefit manager in this case called DentaQuest that we are going to be working with, but you still have to be credentialed through TennCare. You have to be credentialed and enrolled through TennCare in order to get at that part of the business, so to speak. So we are in the process of doing our due diligence around that. It brings on additional responsibility. It brings on additional infrastructure considerations, additional costs, because now you got to bill. You got to have billers. You got to have the ability to have folks in place to bill and collect and so forth. So we want to make sure that we go into this with full visibility with what the additional responsibilities are that go along with participation in this plan. But at least on the surface, it does look like an opportunity for us, and particularly from a children's perspective, we think that could be very attractive for us, particularly in this region. And by the way, did you want me to say something about the brochure?
Sure.
So at your tables, you'll find our Friends in Need brochure. Feel free to take those if you want some more. I have some up here. We are at the end of the year here, obviously. So what I would ask is that as you begin to make any plans for charitable giving at the end of this year, please keep Friends in Need in mind. Very worthy organizations. Certainly we appreciate any consideration that you might provide. Now, I'll hand it back to Harry and we'll answer any questions you may have, and with Anita's help.
So we wind up doing, we talk about sort of a change in our model. We're trying to look at, you take 10% of your patients, TennCare, 20%, 30%, where's the sweet spot? Because when you have that, you receive something. You typically, TennCare reimbursement is about 40% of what's called usual and customary. 40% of a number is not a big number, but it's higher than 0. And so that's how we're doing it. That's why we're looking for the sweet spot. And that'll be a process over the next 4 to 6 weeks to see, is that for sure where we want to go? And if so, where's the sweet spot with that? Be glad to try to answer any questions you might have. Yes, sir.